Welcome back all of you to Mock Test Explanation Series Part 20 for Government Nursing Officer exams. The first question, Koplik spot is the typical sign seen in option 1 pertussis, option 2 mumps, option 3 measles and option 4 is diphtheria. Let us go to the right answer. Please lock your answers. The right answer is option 3 measles. Koplik spot are the peculiar spot present on the buccal mucosa. It is seen in measles or rubeola. The other name of measles is rubeola. In pre-eruptive phase. So, Koplik spots are seen in measles or rubeola in pre-eruptive phase. You can see the diagram here. The spots in the mucosa, buccal mucosa, which is Koplik spot. This is one of the important and repeatedly asked question. So please pay attention for your exams. Next question. An infant arrived to the emergency department not breathing and does not have a pulse. When starting CPR, where is the correct place to assess for a pulse in this patient? Option 1 carotid, option 2 radial, option 3 pedal and option 4 is brachial. Let us select the right answer. The right answer here is option 4 brachial. To check for a pulse in an infant during a cardiac arrest, palpate the brachial artery on the inside of upper arm. For adult, it will be carotid pulse. For children of bigger size is also carotid pulse, and here for the infant, it is brachial artery. It is more accessible and easier to palpate, especially in infants who have less developed neck. So that is the reason why we are palpating the brachial artery for the pulse in cardiac arrest for an infant. Next question. Elevated levels of anti-streptolysin O, ASO, are seen in option 1 subacute endocarditis, option 2 ventricular septum defect, option 3 rheumatic fever and option 4 is cardiomyopathy. Let us go to the right answer. The right answer here is option 3 rheumatic fever. Anti-streptolysin O or ASO. ASO antibodies are produced by the body in response to a group A streptococcal infection. Conditions associated with elevated ASO titers are: 1 is rheumatic fever, which affects heart, glomerulonephritis, which will affect the kidneys, and strep throat, which will affect throat and tonsils. Next question. A patient presented with acute shortness of breath, cough with pink frothy sputum, crackles present with hypotension, tachycardia and tachypnea. Which of the below the nurse would suspect? Option 1 is pneumonia, option 2 is pneumothorax, option 3 is pulmonary edema and option 4 is pulmonary embolism. Let us go to the right answer. The right answer here is option 3 pulmonary edema. Pulmonary edema is a life-threatening condition that occurs when too much fluid builds up in the leg. Signs and symptoms of pulmonary edema include shortness of breath, wheezing, coughing up pink or frothy mucus. This is one of the important signs. Excessive sweating, anxiety and restlessness, feeling of suffocation, pale skin, palpitation, tachycardia and tachypnea. So, pink, frothy mucus, tachycardia, tachypnea, all those options are given in the question. So, these all are the right answers. Next question. Nagel's rule is used for 1. Estimation of fetal well-being. Option 2. Determining the expected date of delivery, EDD. Third option is counting fetal heart rate and the fourth option is evaluating amniotic fluid. Let us go to the right answer. The right answer here is determining the expected date of delivery. Nagel's rule is a method used to estimate the expected date of delivery or EDD by adding 9 months and 7 days to the first day of the last menstrual period or LMP. We can see an example here. For example, if it is the January 12, the last menstrual period, LMP is January 12, 2002, then we have to add January 12 plus 7 days, that is 19th of January. Then counting back 3 months to get October. So, the expected date of delivery for the patient with the last menstrual period is January 12 will be 19th October 2002. So, this is the method of calculating EDD using Nagel's rule or formula. Take the LMP, add 7 days to the date and count back 3 months. Next question. A nurse is implementing nursing intervention to monitor a patient following kidney surgery. Which of the following complications would be the most likely postoperative risk after renal surgery? Option 1, deep vein thrombosis. Option 2, hemorrhage. Option 3, nausea. And option 4 is hemiparesis. Let us go to the right answer. If you need additional time, please pause the screen for any questions. Due to the time constraints, I am moving faster to the answer. The right answer here is option 2, hemorrhage. The postoperative complications of postoperative kidney surgery are acute kidney injury or AKI, bleeding, blood clots, infections, scars, etc. Here you can see the question. Deep vein thrombosis can happen because of the moving blood clots and all those kind of thrombos, but here that is not the most appropriate answer. Hemorrhage can be the most important and appropriate answer in these options. The nausea is not really related and hemiparesis also not related to this question. Next question. Bagasosis is due to the inhalation of which dust? Option 1, silica dust. Option 2, cotton dust. Option 3, sugarcane dust. And option 4, coal dust. Let us go to the right answer. The right answer is option 3, sugarcane dust. Occupational diseases are due to the inhalation of dust, which is known as pneumoconiosis. The occupational disease due to inhalation of dust is known as pneumoconiosis. Two types are there. Organic is with the vegetable dust and inorganic dust inhalation is also there. Organic dust occupational health diseases like pneumoconiosis are bagasosis, which is due to the cane fiber dust, byssinosis due to the cotton dust, which is also known as Monday fever and brown lung disease. Then tuberculosis is with the tobacco dust and farmer's lung is with the grain or hay dust. Next is inorganic dust pneumoconiosis or occupational health diseases are anthracosis due to coal dust, which is also known as black lung disease. Silicosis is with silica dust. Asbestosis is with asbestos particles, which is also known as white lung disease. And siderosis is with iron, which is also known as welder's disease. So there is a memory trick here to remember these options. So remember these sentences. We are making some sentences to remember. Monday brown cotton business. So byssinosis is by cotton dust. It is also known as Monday fever and brown lung disease. So this is added in this sentence, Monday brown cotton business. Next sentence is white asbestos and black coal from Andhra. Anthracosis is also known as black lung disease, which is due to the coal dust. Asbestosis is also known as white lung disease, which is due to the asbestos. So you have to remember this sentence, white asbestos and black coal from Andhra. The last sentence is iron side welding. Siderosis is also known as Welder's disease, which is due to the iron test. So this kind of memory tips and tricks you have to apply for better memorizing all these options without confusion. Next question. During an evaluation at a community clinic, the patient completes medical history. Which among this is not a risk factor for an acute myocardial infarction? First option is coronary artery disease. Second option is smoking. Third option is hemophilia. And the fourth option is hyperlipidemia. So, which is not a risk factor? This is the negative word question. Be careful about the proper option selection. Let us go to the right answer. The right answer is option 3, hemophilia. So, all the other three options, coronary artery disease, smoking, hyperlipidemia, is related to myocardial infarction risk. So, let us see the myocardial infarction risk factors. Non-modifiable and modifiable factors are here. The non-modifiable factors are age, family history, gender. Males have higher risk. Race, ethnicity, genetic factors, etc. are non-modifiable. We can't modify these factors of MI. But some of the modifiable factors for MI which can be modified are diabetes, obesity, cholesterol, BP, that is hyperlipidemia, blood pressure, hypertension. Then sedentary lifestyle, the lifestyle without exercise, unhealthy diet, smoking, alcoholism, stress, etc. modifiable risk factors. Next question. Vitamin B12 and folic acid deficiency causes, first option, iron deficiency anemia. Second option, thalassemia. Third option, megaloblastic anemia. And the fourth option is sickle cell anemia. Let us go to the right answer. The right answer is megaloblastic anemia. Let us see the vitamin B complexes. Other names: B1 is thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate, and B12 cobalamin. So you have to remember these names, the other names of vitamin B complexes. Now let us see the vitamin deficiencies and diseases. Vitamin A causes xerostomia, night blindness, the deficiency. Vitamin B1 deficiency, beriberi. B3 pellagra. B12 is megaloblastic anemia, which is the answer in the options. Vitamin C causes scurvy. Vitamin D causes rickets and osteomalacia. Vitamin E causes sterility. This is anti-sterility vitamin. And vitamin K is causing the coagulation disorders. Next question. A patient is bedridden with multiple pressure sores. While evaluating the nutritional intake, the nurse should make sure the patient increases intake of, option 1 is protein-rich foods, option 2 water, option 3 is foods rich in vitamin A, and the last option is fiber-rich foods. Let us go to the right answer. The right answer here is option 1, protein-rich foods. Bedridden patients with pressure sores often experience significant protein loss through wound exudates, making adequate protein intake crucial for the tissue repair and overall health. So, protein intake is the most important thing here. To support healing of pressure sores in bedridden patient, the nurse should ensure the patient increase their intake of protein, vitamins, minerals, and potentially amino acids like arginine and glutamine. So here the protein intake is the most important. So here you can see the options. Protein rich foods is the right answer. Water is also needed to maintain the skin integrity and prevent further bedsore formation. Then foods rich in vitamins, not only vitamin A, vitamin E also needed, but all other vitamins also, vitamin C, vitamin E also needed. Then fiber-rich foods is also required for a bedridden patient for proper elimination needs like bowel elimination. But that is not related to this question. So the most appropriate option among this Options are protein-rich foods. Next question. Skin turgor test is used to assess option 1, hydration status, option 2, level of pain, option 3, consciousness, option 4, infections. Let us see the right answer. The right answer is option 1, hydration status. The skin turgor test, a simple assessment of skin elasticity, is primarily used to quickly gauge the person's hydration status, particularly to detect dehydration, especially in children and elderly. So, this figure is for the skin turgor test. Next question. The plan of care for a child with a cerebral palsy should include all the following except option 1 is physical therapy, option 2 is play, option 3 is feeding, option 4 bowel and bladder training. Let us go to the right answer. The right answer is option 4, bowel and bladder training. So, this question you can see except word, that is negative word. So, all the other 3 is needed for a care of a child with a cerebral palsy, but bowel and bladder training is not really needed. You can see the list. Plan of care for a child with cerebral palsy: mobility, walking, play, etc., communication skills, cognition and learning, physical therapy and occupational therapy, assistive technologies, mental and emotional support, education and inclusions, family support and caregiving like feeds, community participation and inclusion. These all are the plan of care for a child with cerebral palsy. Next question. What is the end product of proteins? Option 1, amino acids. Option 2, triglycerides. Option 3, fructose. Option 4 is glucose. Let us see the right answer. The right answer here is amino acid. You know the triglycerides are related to fat digestion. Fructose, glucose is related to the carbohydrate, and amino acid is related to the protein. The end product of protein digestion and metabolism are amino acid. The waste product is urea. You can see the diagram here for proper protein digestion cycle. Next question. A 9-week-old infant boy is with projectile vomiting, decreased urine output and weight loss. The nurse observed left to right peristaltic waves after he vomits. The nurse expects to find which of the below during physical examination. Option 1 is hepatosplenomegaly, option 2 probable pyloric mass, option 3 lymphadenopathy, and option 4 is bulging fontanelle. Let us see the right answer. The right answer here is option 2, probable pyloric mass. Pyloric stenosis is characterized by projectile vomiting. The P is highlighted here for your better memory. Pyloric stenosis is having projectile vomiting, non-bilious vomiting, and a palpable olive-shaped mass in the right upper abdomen. Next question. Monday fever is the other name for option 1, asbestosis, option 2, byssinosis, option 3, silicosis, option 4 is anthracosis. Let us go to the right answer. The right answer here is option 2, byssinosis. We have already seen this chart. Organic dust, bagasosis, byssinosis, which is cotton and Monday fever, brown lung disease. Tobaccosis is with tobacco, and farmer's lung is with gray. Bagasosis with cane fiber. And the memory tricks also we have mentioned: Monday brown cotton business, white asbestos and black coal from Andhra, ironside welding. So remember all these charts for better memorizing. The right option here is Monday cure is byssinosis. Next question. A child is with first degree thermal burn and in great discomfort and does not eat. Which of the following is the priority diagnosis? First option is altered nutrition. Second option is impaired skin integrity. Third is risk for infection, and the final option is acute pain. Let us see the right answer. The right answer is acute pain. Priorities. All priorities include airway, breathing, circulation, uncontrolled bleed, pain, etc. These all are the priorities. So here the child is in acute pain. Acute pain is a immediate priority. Then all the other factors like nutrition, skin integrity issues, risk of infection will come. But first you have to address the pain so that the nutrition issues and the other issues will be supported. Next question. The term toddler refers to age group. Option 1, from birth to 1 year. Option 2, from 1 year to 3 year. Option 3, from 3 year to 6 year. And option 4, from birth to 1 month. Let us go to the right answer. The right answer is from 1 year to 3 year. Toddler is from 1 year to 3 year. Birth to 1 year is infant. Birth to 1 month is neonate. And 3 year to 6 year is preschooler. You can see here the options. Infant 0 to 1, toddler 1 to 3, preschooler 3 to 6, grade schooler 6 to 12, and teenager 13 to 19. Next question. A lady with iron deficiency complains of feeling tired all the time. The nursing diagnosis of fatigue is related to option 1, decreased ability of blood to transport oxygen to tissues. Option 2, an increased abdominal pain and stomach distension. Option 3, decreased anxiety level during hospitalization. And the fourth option is decreased nutritional intake with malabsorption. Let us see the right answer. The right answer here is decreased ability of blood to transport oxygen to tissues. Iron deficiency will be related to hemoglobin because iron is the part of hemoglobin. So if the hemoglobin is less, oxygen transport will be affected. That's why decreased ability of blood to transport oxygen to tissues will be related to iron deficiency anemia. Next question. False perception with stimuli is known as option 1, hallucination, option 2, delusion, option 3, illusion, and option 4 is mania. The right answer here is option 3, illusion. Delusion is a false belief. Illusion is wrong or misinterpreted perception of a stimuli, sensory experience. There is a stimuli, but that stimuli is misinterpreted or wrongly interpreted. That is illusion. Hallucination is a false perception even in the absence of a stimuli. The stimuli itself is not there, but they are just feeling that the sensation. That is hallucination. Delusion is a false belief that is not related to any stimuli or anything. This is just a belief, wrong or strong, unbreakable false belief. Then mania is a psychiatric condition characterized by a period of abnormally elevated, expansive or irritable mood and activity. Next question. Dyspnea is defined as option 1, pallor, option 2, absence of breathing, option 3, cyanosis, and option 4 is difficult respirations. Let us go to the right answer. The right answer here is difficult respirations, option 4. The abnormal breathing patterns are dyspnea, difficult breathing or shortness of breath, bradypnea, abnormally slow breathing less than 12 per minute, apnea, temporary cessation of breathing or absence of breathing, and tachypnea is the rapid breathing more than 20 breaths per minute in adult. Pallor is skin paleness and cyanosis is a bluish or purplish discoloration of the skin. So color code is also there for identifying the pallor and cyanosis. Next question. Removal of an entire lung is known as option 1, pleurectomy, option 2, pneumonectomy, option 3, bulbectomy, and option 4, lobectomy. Let us go to the right answer. The right answer is option 2, pneumonectomy. Pneumonectomy is a surgical procedure to remove one entire lung. Pleurectomy, it is the removal of part of pleura. Bullectomy, that is remove air pockets in the lungs, that is called bullae. And the lobectomy is remove a lobe of the lung. So these all are the different terms related to the surgical interventions of lung. So here the entire lung is removed, that is pneumonectomy. Next question. The nurse is monitoring a patient's urine to determine hydration status. What urine color indicates best hydration? Option 1, clear, option 2, amber, option 3, tea, Option 4, pale gold. Let us go to the right answer. The right answer is clear. Option 1. Urine color and hydration status. Clear pale yellow is normal urine color, and amber color is starting the dehydration, and tea color, it is going to the severe dehydration. You can see here, overhydrated, boot hydrated, then fair. See, from here onwards, dehydrated, then with the increase in degree, the color also will be changing. Next question. Anti-sterility vitamin is known as option 1, vitamin E, option 2, vitamin A, option 3, vitamin D, option 4, vitamin B. Let us see the right answer. The right answer is vitamin E. You can see the list here. We already discussed all this. Vitamin A, Surafthal night blindness, vitamin B1, beriberi, B3, pellagra, B12, metaloblastic anemia, vitamin C is causing scurvy, vitamin D is causing rickets, osteomalacia, and vitamin E is anti-sterility vitamin. So, vitamin E is the right answer. Next question. While caring the child with ineffective airway clearance related to increased mucus production, the nurse would encourage fluids to 1. Maintain nutrition, 2. Prevent boredom, 3. Stimulate coughing, 3. Thin secretions. Let us go to the right answer. The right answer is option 4, to thin secretions. To help thin mucus and make it easier to cough up, focus on drinking plenty of fluids, especially water, and consider warm beverages like tea, broth or warm water with lemon. So, water will thin the mucus, and that is the purpose of taking fluids for a child with a cough. The last question of this part of mock test explanation series is this question, 25th. The umbilical cord contains option 1, 1 artery and 1 vein, option 2, 1 artery and 2 veins, option 3, 2 arteries and 1 vein, and option 4, 2 arteries and 2 veins. Let us go to the right answer. The right answer is option 3, 2 arteries and 1 vein. Let us see the diagram. The umbilical cord typically contains 2 arteries and 1 vein, or encased in a protective gelatinous substance called Wharton's jelly. You can see the 1 big vein and 2 arteries here. So, 1 vein and 2 arteries. 1A, 1V, 2A. 1 vein, 2 arteries. So, we are winding up this session for today. Thank you all for watching this video. Please like, share and subscribe for more videos on exam preparation. Thank you so much.